Hi, hello everyone, and welcome to this evening's UCSF virtual alumni program, UCSF and Climate Change, Advancing Healthy and Equitable Solutions. My name is Arianne Teherani, and I will be moderating today's event. I am a professor in the Department of Medicine and the founding faculty co-director of the University of California Center for Climate, Health, and Equity. My research is focused on education as a core solution to the climate change and health crisis. My work has really been centered on identifying the vital role of education that occurs in the local context and through community engaged medical education, and its role in learning and sustainable thinking, and the continuum to clinical practice. I'm joined today by a group of esteemed colleagues who also belong in the center with us. A brief overview of the center is that we recently launched the center. It's a UC-wide center, which includes all 10 campuses, which is housed at UCSF. So UCSF is the home for the center, with support from the University of California Office of the President, as well as the UCSF Chancellor's Office. This has been the culmination of several years of tireless effort and advocacy from many faculty, students, and staff to activate UCSF and the UC system to address this important societal challenge. The center's mission is to harness the expertise and leadership of the health sector to drive ambitious climate action for health and health action for the climate. These efforts are channeled through 4 typical pillars that most academic centers have: research, education, policy, and healthcare system sustainability. Ultimately, our hope is, and our vision is to advance equitable and just climate solutions that promote human health and a healthy planet. And we are here tonight to discuss the innovative research and action on climate change and health. There is climate change action happening at UCSF that impacts all of our health professional schools at all levels and essentially all of us. And so we're excited to be here to let you know about what we're doing. Couple of things before we start today's programs. I'm going to review a few housekeeping items to help with your experience. To submit a question during the presentation, there is a Q&A box. Please go ahead and submit your questions there. Please keep your questions brief. Given the size of the audience and the number of questions, our speakers may not be able to answer everything. So we're hoping you enjoy the conversation, and please allow me to introduce our speakers for this evening. So Naomi Beyeler leads the Climate Change and Global Health Initiative at the UCSF Institute for Global Health Sciences and is Managing Director in the UC Center for Climate, Health, and Equity. Her research focuses on exploring how the health sector can better prepare for and mitigate the health risks of climate change and contribute to efforts that strengthen climate policy. Through the use of qualitative and implementation science methods, she works closely with government, civil society, and international partners to develop policy-relevant research. Naomi has a master's degree in public health and city planning from the University of California, Berkeley, where she studied the social determinants of health. Karly Hampshire is a 4th-year medical student at UCSF, planning to pursue a career in internal medicine with interests in medical education and the health effects of climate change. She is the founder and co-director of the Planetary Health Report Card, which is a student-led, metric-based initiative to inspire planetary health in medical schools, and has evaluated more than 60 schools globally. She's currently on a research year exploring the impacts of extreme weather on HIV outcomes and working as a fellow in the UC Center for Climate, Health, and Equity. Welcome, Naomi and Karly. So, a question for us to start with. We have discussed the climate and ecosystem crisis as having a profound impact on planetary, which also includes human health. Novel interventions and solutions are needed to move the needle on the actions for climate change. Could you each speak about the novel work you've been leading to impact climate change? You know, what drew you to this work? What were your goals for this work?
Absolutely. I can start us off. Thanks, Arianne, so much, and thanks to Alumni Relations for hosting this important panel this evening. So one of the things I've learned in communicating climate change is that numbers numb, but stories stick. So I'm going to share my introduction to this work as a story. So I started medical school at UCSF in 2018, and that September, the deadly and destructive Camp Fire raged through Paradise, California. I'm sure many of you on this call today remember the hazy, smoke-filled dystopian sky at that time. And contemporaneously with that awful wildfire, we were ironically in our pulmonary block in medical school. Yet, despite the fact that we were walking to school every day in N95 masks through an eerie dusk, breathing in some of the worst quality air in the world, with many in the city, especially the most marginalized, experiencing the health consequences of that, there was essentially no mention of the health effects of air pollution or wildfire smoke once in our curriculum. And it felt like a real missed opportunity to address the impact of climate on human health. And I felt like what was going on inside the classroom felt really disconnected from the realities of the outside world. So several classmates and I were struck by this profound lack of planetary health education. We felt that as future health professionals, we must be prepared to address the very real impacts of environmental changes on our patients' health, and that this preparation was in the hands of the institutions providing our medical training. And it wasn't just curriculum that we wanted. We also wanted our institutions to have research facilities, community engagement initiatives, hospital sustainability practices, and student opportunities that reflected the profound threat that climate change and other forms of ecological destruction pose to really everyone's health. And we learned that desire for a curriculum on climate change and health was more widespread among medical students than perhaps what we had initially thought. So a recent research survey that I led found that among 600 medical students at 12 geographically diverse US medical schools, 84% of students believe that the health effects of climate change should be included in the core content of a medical school curriculum, but only 13% believe that their medical school was currently providing adequate education on the topic. So building on the foundation of our own lived experience, as well as the widespread support for climate and health content in medical school curricula demonstrated by our research, in 2019, several UCSF colleagues and I, with the help of many wonderful mentors, including Arianne, founded the Planetary Health Report Card, which is, as she said, a student-driven metric-based initiative to evaluate and inspire planetary health engagement in medical school. So there are a number of metrics that we created across 5 categories: curriculum, research, community engagement and advocacy, support for student-led initiatives, and sustainability. And the goals that we had in mind in creating this tool were, one, that the report card could function as a needs assessment tool to identify medical schools' planetary health strengths and opportunities for growth, and then function as an institutional advocacy tool to engage administrations in making the necessary improvements. And then 2, in putting together their report card, schools could then assemble synthesized medical school specific information on the resources of their school that could then be disseminated to faculty and students as a summary and global overview. And then 3, the annual summary report could facilitate some cross-institutional dialogue and sharing of resources by showcasing examples of innovative forms of engagement. So I think knowing that a program exists somewhere out in the world and having access to all of the associated links and contact information perhaps lowers the activation energy for leaders at another program to create something similar, avoiding a reinventing the wheel scenario. And then 4, because this is an annual undertaking, the report cards allow for tracking school level and global progress in medical school planetary health engagement, which otherwise can be a challenging thing to do. And then lastly, and most importantly, we developed this initiative to do our small part in our available sphere of influence to advance the global planetary health movement in pursuit of a healthier and more equitable world, as we all are trying to do all the time. So I'll leave it there for now and can touch on other details about the initiative and related work as they arise in other questions.
Amazing. Thanks, Karly. It's so important that we have our health professionals trained in climate change to make sure that our health workforce is prepared to address the impacts that we're already starting to see. I'm going to take us to a completely different region of the world and a very different dimension of preparedness, which is the resilience of our healthcare systems. So I'm working in the Philippines right now with colleagues from St. Luke's Medical College on a program really designed to support the climate resilience of municipal health systems. And our project is designed to take on 2 very different challenges that are happening at the same time which is the need for health systems to become more resilient to climate change and the very limited funding and budget that's available to help health systems make that change. And so just really quickly before I talk about the actual intervention that we're doing, I'll just give a little bit of background on those challenges. So first, health systems around the world are incredibly unprepared for what's coming with climate change. Climate change is changing the health risks that we're facing and the distribution of those risks. So Karly talked about California and the wildfire smoke, but we're already seeing these events like heat waves and wildfires create surges in ER visits and hospitalizations. And climate change is also impacting the social determinants of health, things like increasing poverty and migration that are contributing to higher burdens of disease and placing more stress on our healthcare systems. And at the same time, climate extreme events like hurricanes and floods are directly damaging and destroying healthcare facilities, causing major disruptions to service delivery and overwhelming facility capacity. So in the Philippines, where we're working, a few months ago in December, Super Typhoon Rai hit the country and destroyed over 150 health facilities, disrupted services in many more because of power and water outages. And of course, interruptions in the supply chain and transportation and staffing impact the quality and accessibility of care during these climate emergencies and for many months after often as well. And then the second challenge that we're looking at is the financing. So there's a huge shortfall in the level of investment needed to build health systems that can withstand these climate impacts and make sure that communities really have access to the health services they need during climate crises. And that kind of redesign and rebuilding of the health system for resilience takes an enormous amount of money. Health systems around the world are already underfunded before the pandemic. The pandemic has stretched systems even more thin. But when we look globally at financing, we just see that there's a huge gap. So globally, less than 5% of all spending on climate adaptation targets the health sector. And then even less, just 3% of donor funding for health targets climate change adaptation. So this climate health financing gap leaves health systems without critical support at a really critical time. And that's what our project is really designed to address at the very local level. So we are working with municipal leadership in 3 Philippine cities to develop climate health action plans and resource mobilization plans that are designed to generate local and national financing for resilient solutions. And we have kind of 3 main components to the work that we're doing. So the first thing is that we are training municipal health officers and mayors to conduct rapid climate health needs assessments for their local health systems and supporting them to design climate health action plans that target priority areas for resilience. The second thing we're doing is we're training municipal leaders on climate and health budgeting, climate and health finance, and also resource mobilization. And so that includes providing direct support to local health departments on how to develop funding proposals, what kind of financing mechanisms are available, and the process for applying for that, and kind of supporting them through that. And then the last thing we're doing is really trying to build the relationships, so facilitating partnerships between health, climate, and finance leaders at the municipality level, but also at the national level, to kind of put in place that coordination and relationship building that really helps drive political will and financing towards climate health resilience. So we're in the super early stages of this work, but really the goal and what we're trying to do is build a model that can be used and scaled for climate health planning, budgeting, and budget advocacy that other communities in the Philippines and other climate vulnerable countries could use to mobilize the financing they need to enable resilience. Thanks.
Thank you both. Very interesting and very globally and impactful solutions. How are you both hoping to see the important work that you are doing grow and continue to impact?
Yeah, sure. I'll pick up. Thanks, Arianne. So I was just talking about work that's happening in 3 cities in 1 country. But today, millions of people around the world still do not have access to basic health services. And I think the pandemic has really highlighted for people outside of the health sector how vulnerable our health systems are and also how important they are. And that vulnerability is really only going to grow as the climate crisis accelerates. The WHO recently did a survey of over 100 countries, and they found that only half of the countries reported having a national climate change and health strategy. And then, of course, like cities and states are doing climate adaptation plans, but often health is not included in those adaptation plans or not adequately included. So there's a huge potential and a huge need to expand this type of implementation work and to work directly with health systems to really strengthen their climate preparedness. I talked about the financing, and that's something I'm particularly interested because it's going to be so critical to unlocking some of the progress that we really need to make and to really build the health systems that we need. And we know that health impacts of climate change are very unequally distributed between countries and within countries. And many of the parts of the world that are experiencing already the greatest impacts of climate change have the most under-resourced health systems and the lowest levels of existing healthcare coverage. And the financing right now in climate change and health just doesn't adequately prioritize the most vulnerable countries. And it also often doesn't reach the local level. It doesn't reach the community level. And that's where I think the solutions lie. I mean, adaptation is very local, so communities need to have access to that financing to develop the solutions that work for them. So I think a lot more could be done to understand how to finance climate resilient health systems, how to expand the pot of money available, but also looking at the mechanisms to really target that better to impacted communities.
Yeah, so important, Naomi. It's great to hear you talk about how your efforts and expertise are being leveraged globally to build climate resilience. And across the world, there's this sense that we're all in this together, but not just from a vulnerability perspective, as you're highlighting, but also a strengths perspective, as we're seeing with the growth of the Planetary Health Report Card community, which I can talk a little bit about. So since our inception in 2019, the Planetary Health Report Card initiative has really grown in ways that we never could have dreamed of starting off. So last year, over 60 medical schools in 5 countries completed an evaluation. And this year, the evaluation of over 80 medical schools in 7 countries is underway, including the new addition of Japan and Germany. But what is really exciting that we're seeing is how the Planetary Health Report Card is catalyzing institutional change and perspective change, more from a cultural perspective. So we have collected some data on changes catalyzed, and as an example, at UCSF, the report card results were used as a needs assessment to successfully obtain a grant for longitudinal climate health curriculum, integration of which is now underway, led by some incredible people here. But in addition to the data, it feels like I'm constantly on meetings where students and faculty are presenting on curriculum changes initiated by involvement with the report card. Like yesterday, a friend texted me, hey, can you hop on this meeting when we're free? If you're free, we have low attendance. And then someone in Scotland was presenting on how report card results were being leveraged to create curricular change there. So it's not just doing a needs assessment and sitting on the results, it's creating proposals and writing grants and establishing new community partnerships with those results. And we've really tried to foster a supportive community in that regard. For example, we hosted our first conference last fall where students from schools all over the world presented on their advocacy efforts related to the report card. And we also created an institutional advocacy guide with best practices for getting administrative buy-in. And then we also have regional and community-wide check-in meetings for students to share their relative challenges and successes. And then in terms of some other future directions that we're pursuing, we're expanding to other health professional programs. Development of report cards for nursing and pharmacy training programs is underway, led by some international teams in those disciplines. And there are some initial conversations happening for expansion to physical therapy as well. So please reach out if you're a physical therapist interested in spearheading those efforts. And I think there's a sense of, it's not just medical students and the field of medicine that needs to be doing this. It's a really interprofessional effort, and all of the interprofessional team members have a role to play in adapting to and mitigating climate and health. And then as another future direction, we're also pairing evaluation efforts with curriculum resources that directly address the gaps identified. So at many schools, there are a few really ambitious students, but a lack of capacity from faculty and administrators to help them build a whole new climate curriculum from scratch, especially in these COVID times when everyone's time is really strained. So the question is, how can we pool expertise and resources to expeditiously advance climate and health education and not have to reinvent the wheel at every institution? So to help meet that demand, I am on the core team of a new initiative led by the Global Consortium on Climate and Health Education that's creating a comprehensive open access repository of climate and health learning objectives, slides, and cases. And the learning objectives that they're including, that the slides and cases are based off of, were actually created by a team at UCSF. And this repository should launch this year, so hopefully you all can log on and see it. And then in the future, it will also be expanded to include resources for other health professionals, other proposed future directions, including adding patient educational materials, or even sustainability QI project templates. So excited to see where this all goes.
So am I. Looking forward to the dialogue continuing. So what do you feel future direction of healthy and equitable climate solutions will be?
Yeah, I can speak a little bit to that. It's a great question. First of all, I would say that though momentum surrounding climate change action has been growing for a long time, over many decades, the health sector is a relatively new player in the movement. And yet climate change is a health crisis and climate solutions are health solutions. I feel like a broken record saying that all the time. So it makes sense for approaches to be in sync from a climate perspective and a health perspective. And I think there's increasing recognition of this fact, but we still have a long way to go. So one future direction being that climate mitigation and adaptation efforts need to be included in health-focused policy, and health and equity approaches need to be included in climate-focused policy, especially when it comes to doing the cost-benefit analysis from a financing perspective, as Naomi highlighted. And I say cost-benefit analysis because when you factor in the health consequences of climate change and the indirect economic costs of those, previously expensive policies perhaps no longer seem so expensive. And there's this really interesting paper in Nature on the social cost of carbon that basically gives you an equivalent dollar amount in indirect economic costs caused by every ton of carbon emitted. And to give you an example of how this can be applied, I'm working on a research and advocacy project with Arianne now, looking at the environmental cost of in-person interviews for medical school residency and fellowship, and advocating for a permanent transition to virtual interviews, both for equity reasons and climate reasons. And those students spend a truly heinous and inequitable amount of money applying to and interviewing at all these programs. When you plug in the carbon emissions generated by all these flights across the country into this social cost of carbon calculator, the indirect economic costs of the associated climate change caused by the flights actually exceed the direct economic costs of paying for the flights. And then more relevant to health, there's also a new mortality cost of carbon calculator, also published by Nature, which provides a carbon emission to mortality conversion. So anyways, first future direction being climate and health policy and health and climate policy. And then the second future direction that I foresee is healthcare decarbonization. The emissions of the healthcare sector are truly massive. Like if the global healthcare sector were a country, it would have the 5th largest emissions in the world. And unlike other sectors that are contributing to climate change, we have a moral imperative to do no harm, and yet we're actively doing harm with our energy intensive and unsustainable and toxin producing practices. So I think the healthcare sector has an opportunity to lead the way in decarbonization, serving as a model for other sectors. And at UCSF, there have been some successes. They recently replaced the disposable PPE gowns with reusable gowns in the hospital. And Seema Gandhi has been leading efforts to replace the anesthetic desflurane, which is a potent greenhouse gas, with sevoflurane. But we have a long way to go, clearly. And two of the barriers I hear about for instituting more sustainable practices in the hospitals are one, cost, and then two, infection risk, especially in COVID times. So want to speak to each of those briefly. In regards to cost, I think, first of all, we need to broaden our view of cost beyond just the direct economic ones. If we take a broader perspective, the decision-making equation totally changes there. And also there can be huge cost savings with these switches to sustainable practices. For example, I was in a healthcare decarbonization webinar this morning, and the chat was very active, and someone shared that at a hospital in Albuquerque, they switched to reusable surgical gowns, and it saved the hospital system about $150,000 annually. And then in regards to the infection risk, certainly there are situations in which that comes first, and it might be necessary to use single-use items, but I think there's often a non-evidence-based assumption that all the waste we're generating is somehow helping to mitigate infection, even if there's no published evidence for it. And at this decarbonization webinar this morning, they were sharing this example of this eye hospital in India called Aravind Eye Care System, and they're very committed to sustainable practice, but during COVID, they were forced to take off some of those sustainable practices for higher level infection control reasons. So with COVID, they were forced to re-add in some of those infection control measures. For example, each patient was now gowned during the surgery. Surgical gloves were changed in between each case rather than being disinfected. They had to clean OR floors and counters, and only one patient at a time went preparation and surgery in the OR rather than multiple patients at a time. And they looked at post-op infection rates, in particular endophthalmitis and eye infection. And the incidence of this infection before and after the practices were changed were essentially the same. It was 0.005% before and 0.006% after in a sample of tens of thousands of patients. So it just goes to show that a lot of the things that we do are unnecessary, and we think we're doing them to mitigate infection, but that's not necessarily the case. And I'm actually thinking about specializing in infectious disease, and I'm hoping that part of my career can be perhaps debunking some of these sustainability versus infection safety pitted against each other type myths. And I'll turn it over to Naomi to talk about her perspectives on the future directions of this movement.
Yeah, thanks, Karly. There's, as you can tell, so much that can be done by health professionals to take on climate. I mean, just any dimension of practice, education, systems work, health leadership is going to be critical in every domain. Just thinking more about our global climate and health work, and again, I'm sit in an academic institution and work as a researcher, so thinking kind of from the research perspective too. One thing that I would like to see moving forward is the type of research that we do, what our research agenda is. And we know a tremendous amount about how climate change is impacting health. Everybody knows that because everybody around the world is now experiencing that. And we do know some about what we can do to address this, but I really think more work on solutions is going to be so important. We need that solutions research that helps us understand, how do we build climate resilient health systems? What does that even mean? How do we do that in a way that promotes equity, that promotes sustainability? How do we do that in a way where these systems are strengthening efforts to achieve universal health coverage? So I think a pivot towards that is going to be really important. And another piece of that is more work to evaluate the innovation that's happening. So, I mean, all over the world, communities, countries are innovating and trying to figure out what to do. And I think there's a role for research to evaluate that and elevate and share solutions across systems and across countries. Another thing related to research that I think will be increasingly important is to think about the way that we do research. And I would like to see a big transformation in how we do climate and health work. Because to get to the kind of practical and effective solutions that really meet the needs of vulnerable communities, I think communities should be driving the research agenda and co-producing research. And I was at COP26 in Glasgow last year, And I heard Dr. Hawk from Bangladesh, who was saying we should stop talking about vulnerable communities and we should start talking about first adapters, because it is these communities that are adapting and figuring out solutions, and they should be in the driver's seat doing that. So I would like to see a new way of doing global health work that does not reinforce inequities, but is really empowering local organizations and creating more inclusive ways to create knowledge and build solutions. And then I guess just one more thought, which is in a completely different vein, but I've been talking a lot about resilience and my work on resilience. I think that's really important, but ultimately, addressing climate change is going to mean a major societal transformation away from fossil fuels. So I feel like I would be remiss if we made it through a whole climate change session and did not say that we need to move away from fossil fuels. And that is going to take action in the health sector. I mean, Karly was just talking about the tremendous role that the health sector has in carbon emissions and therefore decarbonization, but it's also going to take work in transportation, in housing, really across our whole society. So I have been personally very heartened by the growing community of health folks who are working on climate and calling for that kind of change. But thinking about the future in the very near future, I would like to see that movement continue to grow and grow rapidly, and see all of us as health professionals really kind of embrace a role as advocates.
Thank you both. Very informative, very forward-thinking and solutions-focused. Now, a question for both of you is, how can our alumni become more involved in UCSF climate health activities or learn more about what they can do in their own practice?
Yeah, that is a really great question. And I'm going to start with one small thing. So there is a very prominent climate scientist and climate communicator, Dr. Karly Hampshire, and she often says that the most important thing you can do to fight climate change is to talk about it. And I think for me, that's even more true for health professionals. Climate change is a major health threat. A lot of experts say that it is the most significant public health threat of our time and will be for the future. And so we have a responsibility as health professionals to address it. There's also a lot of evidence, and we know now from communications research, that health professionals are among the most trusted messengers for sharing information about climate change, and a health message resonates with people because we all care about our health and we all care about our children's health. So whether that means you are in clinic and talking to your patients, or you're going out and talking to your policymakers, what we say as health professionals matter, and we therefore can and should use our voice and that health message to bring people into climate action, and also to advocate for our cities and our states and our federal governments to be taking meaningful steps to address climate change. So that's kind of like the macro level, but there's a lot of opportunities to get involved. So I will hand it over to Karly and Arianne, you as well, to talk about some more immediate next steps.
Absolutely, Naomi. I love that quote from Karly Hampshire, and it's one of the reasons that I continue to say yes to speaking opportunities like this, even though public speaking is not my favorite thing in the world. But I also agree that health professionals have a really powerful and often untapped voice in the climate movement. And there was this paper in Annals of Global Health, I believe, that surveyed thousands of Americans on their perspectives of climate change and health education. And one of the questions they asked was, who is the most trusted source of information on the health effects of climate change? And the most popular answer among respondents was primary care physicians, more than the CDC, more than climate scientists, more than many trusted sources. And yet the majority of health professionals feel entirely unprepared to engage in discussion with patients on climate change and health. They just haven't been trained in that. So if this sounds like you, I encourage you to seek out the many resources that are available online, lots of grand rounds, lecture series available. Harvard and Yale, I think, both have great free online courses. And for a more basic overview, faculty at UCSF developed a mini medical school for the public, recordings of which are available online. And then for directly policy relevant educational resources, the UC Center for Climate Health and Equity recently hosted a panel event moderated by Naomi on a new draft rule for a 1 kilometer setback from oil and gas drilling, which you can find on our website, climatehealth.ucsf.edu. And we also have a newsletter there that you can sign up for, which summarizes literature on climate and health topics. And then if you're interested in contributing to climate and health education efforts, you can sign up for to be a faculty advisor or reviewer for the Climate Resources for Health Education initiative that I referenced earlier, or help one of our faculty leaders, Catherine Gunling, with her initiative to create a repository of patient educational materials. But to zoom out a bit, I want to close with the advice that I give to anyone who asks me what they can do to make a difference in the climate crisis, which is borrowed from Dr. Arianne Elizabeth Johnson, who's a marine biologist. And I think one of the unfortunate things about answers to the ever-present "what can you do about climate change" question is that the answers are so general and also focus a lot on individual carbon footprint. Everyone be vegetarian, everyone travel less, everyone compost. But I think our power lies in doing what we can, leveraging our unique skills, passions, and spheres of influence. So how can work in climate intersect with what you're already doing, with what you already love doing, whether that's podcasting or organizing Excel spreadsheets or research or patient care. And to illustrate this, Dr. Johnson created a Venn diagram for approaching climate action. And so in the first circle, she urges you to think about what is the work that needs doing, what climate and justice solutions will actually be impactful. And the second circle is, what are you good at? What special skills, networks, resources do you have going for you? And then lastly, the third circle is, what brings you joy? What gets you up in the morning? This work can really be emotionally draining, as all three of us can probably attest. So if you're not considering that piece as part of the equation, you will burn out. And then at the sweet spot in the center of those three circles, that's what you should do to tackle climate change.
Thank you both very much. We'll end there. And now we're going to take some time to answer some of the questions by the audience. For those of you who are still interested in submitting questions, the Q&A is up and you can feel free to start there. There are quite a few questions that have come in, so I'm going to try to prioritize. The first question is, what are the best ways to make our practices in clinics, offices, and in the medical center more sustainable?
I think there are a lot of really great resources out there in that regard. It's a great question. Of course, you just want to start with what you already know, the environment that you're already in, rather than immediately going to policy change. Although, of course, that's really important. I would point you towards My Green Doctor, which has a lot of good clinic resources. And then Practice Green Health is a really good resource for hospital systems as a whole. And I know I've been not very good at posting all of the things that we've been referencing in the chat, and so I'll try and be better about that going forward.
There is a question that just came through that is, I think, will be an easy answer. Is there a list of which medical schools have completed the Planetary Health Report Card? And how could I check to see if a school has already?
Yes, I can answer that very easy question. You can go to our website, phreportcard.org, and there are the individual school-specific reports available that you can download, as well as on the homepage, there's an interactive map where you can just see the global landscape of all the schools that have participated.
Thank you. What are the practical ways to educate our patients and communities to respond to heat, pollution, et cetera?
I can speak a little bit to that as well, and Naomi, feel free to jump in. I think there are a lot of amazing efforts underway to build out more patient education resources. I talked about the patient education repository that Catherine Gundling is working on creating here at UCSF that hopefully will be available soon. And many students are working with her on that as well. And then I've also heard of other ongoing efforts to build out patient education resources from people at the University of Colorado Climate and Health Fellowship Program. Maybe some of you are familiar with the Vote ER model. Basically, this was a badge backing that attached to people's hospital badges, and there was a QR code on it that people were supposed to use as a catalyst for having conversations about getting people registered to vote in the ER. And so they're building out a similar model with climate and health. So a badge backing that says something along the lines of like, any questions about the health consequences of climate change. And it allows the patient to initiate the conversation, since I think providers are often uncomfortable to bring it up on top of everything else they have to talk about in a patient visit.
And I might add in just a slightly different direction, not so much patients, but more on the education side. And Arianne, please feel free to chime in as well on this. But, the universities are doing education at all levels, not just for our medical learners, but also more broadly. And so I sit within the Institute for Global Health Sciences here at UCSF. And over the last couple of years, we've been doing programs where we're training high school students in global health and providing internship opportunities for high school students to learn about global health. And we've also been training high school teachers and helping them develop curriculum for how to integrate global health topics into their curriculum, and to train other teachers at their schools. And I have been working with those students and those high school teachers for the last couple summers, and including climate in that type of educational program. And I think that's something that we're well suited to do as a university and interested in expanding as well as part of our educational mission. So I don't know, Arianne, if you want to chime in any more on some broader education components, but.
Yeah, I mean, I think, no, those are great, Naomi. Nothing very specific to say, except that, this is why education is so very, very important. There's a lot of folks who still don't fully comprehend the impact on health, and that ranges from, health professionals to learners. I mean, of course, teachers and students in the K-12 system are definitely need to keep up with this as well. And this ability to be able to reach a lot of audiences, to make sure they understand the impact of the climate crisis on health, make sure they have the tools with which to know what to do, how to protect themselves, how to protect the planet they're on, is very, very key to this dialogue. And I do remember when I started doing this work in the mid 2000s, so about 2008 or so, I remember speaking to many, many people and saying, do you know that climate change is impacting health? And they would look at me blankly, like, what are you talking about? And now that is no longer the case. So there's definitely, over the past little over a decade, with how the environment's changing, with all the dialogue that's going on around us, society is becoming more and more aware, but they do still need a lot more tools to be able to address the concerns and issues. And I do think Naomi's work with the K-12 learners and with teachers is incredibly important to creating a whole series of, it's a very powerful tool for education and bringing folks up to speed. There is one question that just came in. And I'm going to go to this one because I think it's actually very important. Are there any countries or micro health systems that are doing sustainability and adapting planning well?
Yeah, that's a great question. I think a lot of countries are doing many interesting things. So, in the UK, for instance, they have incredible efforts on sustainability and have really been leading the charge on sort of taking climate change considerations into their health system work. And then there's programs all throughout the world to do things like solar in health systems. One, because that's good for sustainability, but also that's really good for having a reliable power supply when your power grid is not reliable. So I think there's a huge amount of examples, from countries throughout, Africa, Asia, Latin America, doing all kinds of interesting work on resilience, on different design components, on clean energy sources, which is both an adaptation and a mitigation intervention, all the way to hospitals around the US who are also leading that work, thinking about different design features that both make them more resilient, having, like I said, better energy that's both cleaner and more reliable during emergencies. So lots of examples, and Karly mentioned Practice Green Health, but another resource for looking at that kind of innovation is Healthcare Without Harm. It's kind of part of that same organization, which is really working with health systems around the world and cataloging some of that innovation.
I don't know nearly as much as Naomi does about all of the health systems worldwide and their mitigation and adaptation efforts. But one thing I will comment on is that it's been really interesting working with students in the UK on the report card and seeing how our education is different in a sustainability lens. So we've just made the observation that a lot of their climate education is sustainability focused and how can they bring sustainable practices to their clinical practice. Whereas I think in the US, it's much more about the health consequences of climate change. And we don't really learn about how to do sustainable practices, at least in my experience. And I wonder if that has to do with single payer healthcare and who's actually paying for the costs and whether it's all integrated or decentralized.
Yeah, that's a fair point. There are a number of questions that have come in that have to do with some of, I think, what both of you have talked about, really making meaningful change to reduce medical waste. For example, packaging for medicines, repackaging in oversized containers, the US being more wasteful than other countries, things like disposable plastic or biodegradable materials. So any ideas from either of you about really what that meaningful change in medical waste can look like?
It's not exactly my area of expertise. I think it's really important. One thing I think is that when an individual hospital system does something and has success with something, there need to be better mechanisms for scaling that work throughout other health systems. Like even on this decarbonization webinar this morning, people are in the chat about, oh, my hospital system did this. And without having those personal connections, there's really no way of being able to bring that to another hospital system, because a lot of these are internal QI projects and not getting published anywhere. And so I just hope that the framework for that can shift going forward.
How can UCSF and the UC system at large leverage its size and influence to change policy legislation to move towards zero emissions and support lower income countries who have suffered the most from climate change, yet have contributed almost no carbon emissions to the overall burden?
Yeah, that's a very big question. So one thing is that California is in many ways a leader on climate change and also on climate change in health. And the UC system is actually also a leader on climate change and healthcare decarbonization and climate change in health. And so I think, when I think there is opportunity for us as the UC system to really work with the state to advance the leading edge of what that means. How can we do really ambitious climate work and have really ambitious climate policies that also maximize the co-benefits for health and also health equity, and make sure that our solutions are equitable, that they promote health equity in our communities. And I think that's one thing that we can do, is lead by example, and share those lessons that we're learning and be part of this kind of global community that's thinking about health sector decarbonization and also resilience. And of course, we're also a research institution. So I already talked about, how can we do research that is truly partnered with other communities and other countries in a way that's really supporting innovative solutions that are locally driven, and how can we, as sort of an engine for research, do that in a way that's elevating all kinds of innovation, and then doing what Karly had said, the evaluation, the sharing, in a venue where people can really access that information.
There's one question that has to do with building climate curriculum in a high school, convincing your school district it's important, and actually building the curriculum. I'm going to quickly answer this through one announcement, and then of course, eager to hear from both of you. Like Naomi said, California is a trailblazer in this area, and in 2019, the University of California, working with the state of California, announced that they would be infusing and educating all learners starting from kindergarten to 12th grade about environmental literacy. So really understanding the way that environment, the importance of the environment, and also the surroundings around environment. Part of that initiative was also to modify the national science standards to get those up to date to include environmental science, but also really thinking about many things like the social nature of the environment and embedding that within all aspects of what our students learn. That work was a joint effort that, like I said, cut across the UC system, but was led by UC San Diego and by UCLA. I believe it was temporarily put on hold when the pandemic hit, but I do think that work has commenced, and now the home for that work is the UC Irvine School of Education, and it's moving forward. The plan was for California to be the first state in the US that covers the environment and climate change starting from the beginning, from beginning meaning kindergarten. And so I want to make sure that folks know about that. Sometimes it's not even that you have to really do anything, it's happening on its own. And there's a lot of resources. There is a wonderful group called 10 Strands that does a lot of work in California on climate change education, and they have a lot of curricular resources that can be utilized for that purpose. And I'll go ahead and put their link inside the chat. And feel free, Naomi and Karly, to add anything else to that.
And that was beautifully said, Arianne.
Okay, last question. What keeps you up at night?
I can go first. Lots of things keep me up at night. You asked the very first question, how did we get involved in this work and what was our path to this? And for me, I have 3 very young children, and my entry into climate work happened pretty much as soon as my first child was born. So when I think about, what keeps me up at night, it is the daily task of raising kids and working, but that is in the frame of deep concern about what their future holds and what can I do now, as a health professional and as a mom and as a citizen, to make sure that future looks bright for them and really for everyone around the world. So that is what keeps me up at night.
Thanks, Naomi, for sharing that personal slant. Yeah, in terms of what keeps me up at night so much, where do I even begin? I think what really distresses me is the uncertainty of how this all is going to work out. We're in this window right now, it feels like, where we could pull it all together and pass a lot of legislation and have rapid advancements in technology and avoid a worst case apocalypse scenario. But that window seems to be closing. And there's been so much momentum, but I just worry it won't be enough, or it will be too late. And I'm sorry to end this panel with doom and gloom. I think sometimes there's pressure to end panels like this with hope, but also hope can be damaging if people are relying on hope alone to get us through this. It has to be hope paired with action, which I hope is what this panel catalyzes for all of us today.
Hope paired with action. Love that. Well, thank you both very much. We have posted a lot of resources for you in the chat, but also just for you to know, you are free to visit our website. It is climatehealth.ucsf.edu. We sign up for our newsletter, sign up for announcements. We have a lot of education events and announcements for the community, for our alumni, and we do host a lot of events that we include everybody in. That's it on our end. Thank you all.